Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is translating the meeting in Spanish, and his translation will be available immediately after the press conference on both the county's YouTube page and website. Yesterday, there was only one new COVID-19 case in Santa Barbara County not reported by the Lompoc Federal Prison. The Bureau of Prisons reported 57 new cases Sunday. 14 days ago, there were 115 active COVID-19 cases reported in Santa Barbara County. Yesterday, that number had steadily declined to 61 active cases outside of the numbers from the Lompoc Prison. Unfortunately, with the new reported cases over the past few days from the Lompoc Prison, the total number of active COVID-19 cases in our county has risen to 825. The County of Santa Barbara is continuing to try to work with prison authorities to learn more about what is going on at the prison and to offer our assistance to better manage the situation. Our federal legislators are also in communication with prison authorities to get better information to share with our community. Our state legislators continue to urge the governor to consider the present outbreak a unique event that warrants a different perspective and different approach. We hope that by isolating consideration of the situation at the Lompoc Prison, we can demonstrate to the governor our county has made sufficient progress to allow faster reopening of local businesses. The initial response from the California Department of Public Health was not encouraging to the county's point of view. Everyone is shocked by the COVID outbreak at the Lompoc Prison. Tomorrow, the Board of Supervisors will consider sending a letter to Governor Newsom outlining the board's very serious concern about being held responsible for the COVID outbreak at the Lompoc Prison. This is an event outside of our control that we have no authority to manage or respond to. Any new information we receive from the state or prison authorities will be shared with the Board of Supervisors at tomorrow's meeting at 9 a.m. This past Saturday, I made a point to visit some local businesses that are now open to customer pickup services. I called around to a number of local florists and fortunately learned that many of them were already sold out of Mother's Day flowers. Fortunately, White House Florists on Upper State Street was able to take my order over the phone, and so I drove over and picked up a wonderful Mother's Day bouquet for my mom. I also bought a couple of books through the Chaucer Bookstore website, paying online. My package of books was ready for pickup in an hour after I placed my order. The friendly Chaucer staff was very careful about keeping physical distances from customers who waited outside the store. In Goleta, I visited Bennett's Toys to buy a Scrabble game to send as a gift, and Sunday morning I went to the Mesa Cafe to get takeout breakfast and support Ramiro and his hardworking team. All the local businesses I visited were trying very hard to keep customers safe. They're being thoughtful and careful, and they deserve our loyalty and support. It's time, especially now, to make a conscientious choice about where we spend our discretionary dollars. All our local customer dollars are needed right here in our own local community. Please go out of your way to shop locally. The Organic Soup Kitchen in Santa Barbara is another local nonprofit organization that has stepped up to help some of Santa Barbara County's most vulnerable residences in response to the COVID-19 pandemic. Anthony Caraccio, the Organic Soup Kitchen's founder, his team and many volunteers are cooking and delivering high-quality, nutrient-dense, healthy soups to hundreds of local residents in need. The Soup Kitchen operates on a philosophy of not turning anyone away in need, but they do have parameters to make sure their food gets to the right people. Last year, the Hutton Parker Foundation helped the organization expand their operations by renovating an old commercial kitchen. The renovated kitchen can now cook 120-gallon soup batches at a time to make 600 24-ounce containers. The Organic Soup Kitchen regularly provides soup to individuals struggling with chronic illnesses and cancer, but has doubled the number of clients it's can serve to meet the immediate crisis. The soup kitchen has the equipment it needs to serve its 400 plus clients, but if they had more funding, they could feed thousands more. The organization offers home delivery with 20 trained volunteer drivers, and the service is available from Summerlin to Goleta and provides nutritious soup to seniors, families, and people with medical conditions right to their front door. The soup kitchen also offers soup pickup, too. The Organic Soup Kitchen has stepped up for our community and filled a critical gap. If you're interested in helping to support and even expand their services to help more people in need, please visit organicsoupkitchen.org, ORGANICSOUPKITCHEN.org. Next, I'd like to introduce Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart.
Thank you, Dr. Ansorg.
Good afternoon, everyone. We are reporting 1,362 total cases in Santa Barbara County today. This is an increase of 54 cases from yesterday. 40 of these are reported from the federal prison in Lompoc, and 14 cases are from the rest of the county. Hospitalized currently are 37 patients, with 10 of them in the intensive care unit. 474 have fully recovered. The Public Health Department is working to distinguish community cases from cases of persons incarcerated at the federal prison. It is important to provide an accurate picture of what is occurring both within the prison and in our other communities. We hope to have more data to share soon. Community-based testing sites in Santa Maria, Lompoc, and Santa Barbara were active this past weekend, and we are pleased to report that over 1,200 community members so far have been tested for COVID-19 at these sites. Unfortunately, we are seeing some delay in the turnaround time, but this should be fixed in the very near future. Nearly all tests received, fortunately, have been negative, but we will know more about the exact data as the week goes on. I continue to encourage community members to go and get screened. Please make an appointment for testing. You can go online to lhi.care/COVID testing or call 1-888-634-1123 to make an appointment. This testing option is available to all community members, and it is free of charge. Our state experts have calculated that achieving a rate of new COVID cases of less than 1 of 10,000 residents over the population over a 14-day period is necessary in order to be able to safely progress in our reopening schedule. Unfortunately, our county continues to have more cases than that. I suspect that even though the majority of our community is taking excellent precautions to prevent the spread of the coronavirus, that there are still many who are not following physical distancing and letting their guard down. I took a stroll on a beautiful local beach this past Saturday afternoon and could not help but notice that almost all beachfront apartments and houses seemed to be fully occupied with guests. A large group of younger people had a party of about 20 celebrating without any physical distancing or any guards. More mobility of people will lead to wider and ongoing spread of this highly contagious virus. I urge everyone to please stick with the plan. Avoid all unnecessary travel. Stay at home and in your neighborhood. Abide by physical distancing. Wash your hands frequently. Wear face coverings when indicated to protect others around you, mainly in stores, pharmacies, and on public transportation. An unintended consequence sometimes of mask wearing is that it sometimes gives false sense of safety while wearing it. Please let me remind you, these face coverings only work in conjunction with keeping a distance and excellent hand hygiene. Due to the later advent of the coronavirus in California compared to other areas in the US or overseas, we are in a great position to learn from their successes and mistakes. As an example, 2 weeks of unhampered spread of the virus in northern Italy in late February and early March was enough time to cause a massive 25% mortality rate just in the province of Bergamo, northern Italy. At least 95 doctors there who took care of initially of these cases died. Fortunately, Santa Barbara County and the state of California implemented the stay-at-home order at a time when we had but a handful of confirmed cases in our area. The early implementation made a big difference. Our hospitalization rate and ICU admission status has remained stable for several weeks now. However, we still identify more new cases than desired in order to limit the ongoing spread of the virus. Please be patient and steadfast. Even though we are in the second stage of the road to recovery, any lapse in caution now will delay our ability to open up more. I thank you for your attention and cooperation.
Thank you, Dr. Ansberg. I also invited Noemi Velasquez, Behavioral Health Outreach Coordinator for the Community Health Centers of the Central Coast, to join us today to share their efforts to help local residents during the pandemic. Community Health Centers is based in northern Santa Barbara County and San Luis Obispo County. Their mission is to enhance the overall health of residents of the Central Coast with special emphasis on the medically underserved by providing accessible, affordable, comprehensive, and quality healthcare services. Welcome, Noemi.
Thank you. Good afternoon. My name is Noemi Velasquez, and I'm with the Behavioral Health Outreach Department at Community Health Centers. We would like to thank Santa Barbara County Supervisor and the Public Health Department for inviting us to this discussion today, as we must continue to keep the mental health needs of our community at the forefront of our response to the COVID-19 pandemic. Over the last 8 weeks, our department has transitioned our focus to meet the immediate needs of the most vulnerable individuals in our county, utilizing telehealth and virtual platforms, as well as direct contact with isolated neighborhoods. Our department has collaborated with the Santa Barbara County's Food Bank to distribute COVID-19 information and emergency food to over 1,000 individuals who live in the isolated pockets of northern Santa Barbara County. In addition, we deliver food to over 100 homebound seniors every 2 weeks. We have also provided psychiatry and counseling sessions to over 3,500 clients over the last several weeks. Our behavioral health integration coaches are managing patients with chronic conditions ages 65 and older that are most at risk during this pandemic. In collaboration with the Santa Barbara County Behavioral Wellness, we have established Zoom meetings to bring mental health resources to monolingual Spanish-speaking, to the monolingual Spanish-speaking community during Mental Health Awareness Month, which is today in May. Thanks to the generous donations from the Bucket Brigade, we have begun distributing masks and information to agricultural workers in our region. We hope to continue these partnerships throughout the valley. We will start visiting farm crews on a weekly basis to provide education on mask use, social distancing, and mental health resources. We are still in need of cloth face masks for distribution to agriculture workers and community members, and are working closely with the Public Health Department's Immigration Response Task Force. CHC has pivoted to a remote platform to ensure that there is no disruption in services as we continue to see a surge in mental health needs. Thankfully, many of our behavioral health clinicians and outreach team are certified through Domestic Violence Solutions and Mental Health First Aid to be able to address the needs of families experiencing violence during this crisis. CHC is proud to offer services in English, Spanish, and Mixteco, which reflects the population we serve in our county. We take great pride as a safety net provider in northern Santa Barbara County, working continuously to meet the needs of our patients and our community. CHC is responsible for more than 111,000 patients in northern Santa Barbara County and San Luis Obispo County. During this pandemic, the Behavioral Health Department would like to recommend that you take care of your mental well-being by continuing a healthy sleep pattern, drinking plenty of water, exercising, obtaining fresh air, getting outside at least once a day can help boost your mood. Personal hygiene, taking care of your personal hygiene is important. Even if you are not able to go out, consider getting ready just like you normally would. Daily routine, setting up a simple daily routine will help the days not blend together. And again, together we are stronger.
Thank you, Noemi, and thank you for their important message and for your work from Guadalupe to Los Alamos to Cuyama.
Thank you.
Thank you. Next, we'll take questions in the room. Ms. Lair?
Thank you so much. Dr. Ansor, can you talk about in the hospitalization versus the ICU, can you separate the inmate population since they have a hospital on the grounds where I believe we consider that two jails or two prisons?
The little hospital on the ground of the prison is not able to provide intensive care. That much I know. It was designed as an overflow place to give relief to the local hospitals. The Bureau of Prisons explicitly asked the Public Health Department to not disclose any numbers or whereabouts of any of their prisoners. So therefore, please understand that I cannot answer those questions.
Yet they give us the names of the inmates, which is quite unusual with HIPAA.
Yeah, I don't argue with you. Whatever the Bureau of Prison decides to disclose to you directly, that is their prerogative, but they asked us explicitly to please abstain from that.
And my other question would be to you and also the supervisor. I, like you, was at a beach with someone on a megaphone talking, calling this a flu. And I also saw a business renting kayaks where they were spraying them down, they had a mask on, but their customers did not have masks. Is this a time where these businesses should require their customers to have masks? And what do you say to the people who are calling this a super flu versus a coronavirus or COVID-19?
You want to take the medical question?
Sure. So the megaphone was somebody called the coronavirus a super flu. Well, this person is misinformed. So it is difficult enough to get the right information, but the COVID-19 is a worldwide epidemic, therefore called pandemic. It is a highly contagious virus, about 2.5 times as contagious as the influenza virus. That much we know now. In addition, nobody has immunity except for those people who went through the disease so far, which means everybody is still very susceptible to catching the virus, especially our elderly people and our people with weakened immune system and underlying health conditions. So, I don't want to preempt the Board of Supervisors meeting tomorrow, but to compare this to influenza is like comparing apples to oranges. It just does not compare. COVID is way more dangerous, way more contagious, and it takes way more lives than influenza. I can tell you that much today. More coming on that.
Would you like to comment on, should businesses require the masks of their customers if the business people are wearing them?
I think everybody should wear masks, and that is not a directive, that's not a requirement of the law, but it's common sense. And with my experience going around to businesses locally, the vast majority of people are. And our consistent, repetitive message is that when you go outside, wear a mask. Protect yourself, be careful, cautious about other people. What you're doing is affecting other people, and that's what we're asking people to do, is to think about others and to work together to achieve this goal that we have set to protect as many lives as possible.
Thank you.
Next, we'll go to questions on the phone.
Yes, we have several. First up is Melissa Newman with KSBY. Go ahead.
Hi there. I spoke with Assemblyman Cunningham over the phone this afternoon, and he expressed to me some kind of, interesting relationship with the Bureau of Prisons. Basically, he was saying that the offer has been made to them to have PPE and other types of protections given to the inmates and to the staff there, and the Bureau of Prisons has said that they don't need any of that. And then when he said they've investigated differently and just been hearing a lot of conflicting things between what people on the ground are saying versus the prison. So I was curious what your relationship has been trying to converse with the Bureau of Prisons, and if more needs to be done on their behalf as far as transparency.
Well, I think that, yes, we would like more transparency. We would like a closer, more collaborative relationship. We are disappointed that the Bureau of Prisons has chosen to not communicate directly with the County of Santa Barbara in the way that would be most productive to protecting public health in our county and in the prison. And we continue to try to reach out and to do the best that we can and work with them. And we have asked our state representatives, and our federal representatives have been very engaged, are communicating with the Bureau of Prisons on our behalf. And we are trying everything that we can do to get more responsiveness from the Bureau of Prisons, but we have been disappointed in the results so far.
You also mentioned that the initial response from the state's health department was not positive in regards to taking the number of inmates infected with the disease out of the county's total. Can you elaborate more on that?
I think that's an ongoing conversation. The governor today, again, in his press conference, mentioned that he understands that there's local variance. We want to take him up on that offer, and we're continuing to work with our state legislators and through the California Department of Public Health to convince them of the unique circumstances that we're facing here in regards to the prison and the COVID outbreak. We are not entirely unique. There are other circumstances around the state that have similar aspects to it. But our situation is very severe in the prison, and we think it deserves special consideration in regards to the governor's reopening criteria.
Is there any way to know how many inmates have been tested, or are we just kind of relying on what the Bureau of Prisons is publicizing?
Yes, the prison is a closed facility, and we rely entirely on the Bureau of Prisons for reporting information to us. We have no independent way to get information or verify what they are telling us.
Thank you.
One quick question before we go to Delaney with the Independent. Someone has asked, does the county have enough PPE currently?
Yes, we do.
Great, thank you. Next up, we have Delaney from the Independent.
Hi. In light of the fact that most of the questions surrounding the prison are, the answer is I don't know, or I can't say. One thing I'm really curious about is the health of prison staff. Those people are our responsibility. And what precautions are we taking as far as the staff that exit the prison? Are they just simply being quarantined at home like an average community member, or is there anything special being done to really make sure that they don't spread that?
Well, on April 18th, the County of Santa Barbara offered to prison guards through the prison administration to do COVID-19 testing at the Lompoc Public Health Clinic. Unfortunately, I believe in the first week of that window of time being available for prison guards specifically to make appointments and come in and get tested, only 5 of the approximately 450 prison guards took advantage of that opportunity. To date now, since that point in time, there have been approximately 60 prison guards tested in to our knowledge through that process. We don't know who else has been tested. That information has not been shared from the prison, but our service continues to be available to them, and we would hope that they would take advantage of that.
Okay, thank you. And then I have a couple of questions actually from readers. One, is there any way that the public can help as far as pushing to separate Lompoc prison's numbers from our numbers? We get a lot of reader questions every day asking, should we be writing letters? Should we be creating a petition? What can we do as citizens to back you and to back local government that to separate the numbers?
That is a great question. Appreciate it and appreciate the offer of assistance. Absolutely, we could use the public's help. If they would like to communicate directly to Governor Newsom, that his mailing address is on the website. As well, letting our state legislators know that the work that they are doing in support of our point of view is very helpful. And if folks want to express that support, please come to the Board of Supervisors meeting virtually tomorrow. Call in and express that sentiment, because we will be discussing the letter that we propose to send to the governor on that point directly.
Thank you. And then last question, I guess this is for you, Dr. Enzorg, but kind of off topic. I've had a few reader questions as well about the dentist. A dental hygienist actually reached out and said that they didn't feel safe or comfortable performing their job still, but at the same time, they're getting pressure from clients and patients to perform teeth cleaning. And the question is, yes, elective procedures are allowed now as long as they're not just cosmetic, but what about teeth cleaning? I guess that's a huge gray area, and there's quite a few people wondering if that's okay or not.
That's really an excellent question. The state loosened the guidelines for dentists to open up wider than just emergency dental care, to include preventive dental care, providing that they have sufficient supply of their own personal protective gear. Obviously, even hygiene care in a dentist's office is a very high-risk procedure, given the exposure of the employees. So other healthcare facilities and healthcare is always really on the front lines with regard to risk of exposure. So I think that would have to be discussed inside a dentist's office with their staff, who would feel comfortable providing these often necessary preventive services under these circumstances, and if they have a very good supply chain of personal protective gear that will help prevent COVID exposure as much as possible.
Thank you, Doctor, and thank you, Delaney. Next up, we have Reza with the San Ynez Valley Star.
Hi, everybody. Happy Monday. And I am wondering about summer camps. Again, just kind of revisiting this. I've had a few of them reach out to me and ask, if there's any movement on that front yet, or if the prison is actively keeping us from moving to the next opening phase. Does that prevent camps from opening as well?
Dr. Enzorg, do you know?
Traditional summer camps like they used to go are not possible to conduct, obviously, under these circumstances. The governor did allow for some summer school activities in order to support parents to be able to go back to work, providing these school activities can occur with good distancing and modifications and enough staffing and so forth. So traditional summer camps is a no. The prison count is really not the only statistical hurdle that we are facing. As I mentioned before, we are still having way more than 45 cases every 2 weeks. So I think it is up to all of us, excluding the prison inmates, to stay vigilant and protect ourselves and our neighbors so that these numbers start to go down more. And so I urge everyone to not focus on the prison so much, because that is not the only hurdle we are facing. We still have to do our homework and get those numbers in the rest of the communities down.
Okay. I have one follow-up to Tracy Lear's question about the kayaking, because I was out at Lake Kachuma this past weekend, and I saw a kayaker, a lone kayaker, out on the water with a face mask on. And I just want to kind of backtrack and really make sure people understand when they need to be using a face mask. Like, I understand if they're near the staffing who is providing the kayak, and then once they get out on the water, can they take it off? So can you just elaborate a little bit on that?
Yeah, that's a good question. Face coverings that we are recommending to wear are basically to protect others from our respiratory droplets. So as you already said, if somebody picks up the kayak, it would be a good idea, it would be recommended from public health to wear a face mask just to protect the employees or, you know, the business that rents out those kayaks. Once you're on your own in your kayak in the middle of the lake, there is really no need for you to wear a mask because there's nobody around you that you could potentially infect. So it's perfectly reasonable and appropriate to take your mask off under those circumstances. In particular, outdoors, a mask is less necessary than in any indoor setting. But be advised again, these face coverings that we wear are mainly to protect other people from us, not so much ourselves from others.
Thank you for the questions, Reza. Next up is Tom Bolton with Newshawk, to be followed by Laura Place with Santa Maria Times.
Thank you very much. I have a couple questions today. My first one, first of all, I'm glad to hear that there will be more information, specificity between the community cases and the prison cases. I wonder if you can tell us sort of what level of detail we can expect from that and when we could expect to get that.
We're expecting to get regular updates on prison cases, which is very important because right now we get these test results and they are like in the almost hundreds every other day. And that is because they are testing the whole population, which is like 3,500 inmates plus 450 staff. That's a lot of tests. And they can only be done in batches. So they are testing everybody regardless of their symptoms or lack thereof. So I know that sometimes prison inmates are also not completely forthcoming with their report of symptoms because of fear of repercussions. And therefore, we are awaiting the prison's numbers with regard to how many are sick, how many have recovered, and how many are sick to a degree that they need hospitalization or intensive care. So that's pretty much what I'm looking for, and in order to watch for trends, watch for improvements, and also be able to give advice on how to improve their outcomes.
I guess I'm not clear. In the information you're going to be putting out, will you be, right now it's all aggregated. So we have numbers recovering out of the hospital or recovering at quote unquote at home. I assume some of that, the home is the prison. Are you going to be separating that so we can really get a clearer picture of what's happening in the community versus what's happening in the prison?
I hope that will be possible, but honestly, I will tell you when I see it.
I think, Tom, that the answer to the question is that we have high aspirations to get more information from the prison, but don't have that information to date.
Yeah, I get that, Greg. My problem is right now you know how many people in the community, for example, are recovering at home, but that's not the way you're reporting it.
No, I know specifically what you asked about, and we are trying to address that. And I unfortunately don't have today the information that you're looking for, but I spoke with Dr. Dovernoso after you sent me your message, and she is working on that. May have more to report tomorrow at the Board of Supervisors meeting.
Okay, I really think that's important. And also, you know, I understand the security issue of not saying where inmates are in a hospital, but not saying how many or even that they're there. I really don't understand why you would acquiesce to that request given the lack of cooperation from the federal officials.
We're trying to take the high road. We're trying to do the right thing, and we're hoping that the Bureau of Prisons works with us.
Okay, good luck. Thank you.
Thank you, Tom. Next up, we have Laura Place with Santa Maria Times.
Thank you. Regarding the number of people who have been tested at the community testing sites, you mentioned that tests from Sheffield were delayed a little bit. Can you explain why maybe those were delayed? And also if those 1,200 people you mentioned who have been tested or have been known to be tested, is that just 1,200 negative results you've gotten, or is the county aware of every test that's been conducted so far?
Yes, let me take the first part of your question first. It's 1,200 tests have been performed. The testing sites are collaboration between the state and a vendor that has been chosen by the state. We are helping out because we want these sites to be successful, but we are not the proprietor of these sites as the Public Health Department or the county. Unfortunately, especially in the first week, there were some glitches with the turnaround time at the lab. The tests that are collected, it's about 130 tests per site per day. At the end of the day, they get transported to a collection site and then go to Quest, which is a big commercial lab that usually has a turnaround time of less than 2 days. So we are expecting to get these test results back within 2 days once the initial glitches have been ironed out, and the people who get their tests will be notified directly via email or text about their results. Positive test results come directly into our CalReady system at Public Health, and we follow up with a contact investigation and a thorough interview about the status of the positive person. Of the 1,200 tests that have been performed over the last week so far, we have yet to receive the majority of the results, and I know that we only had to my knowledge, 2 positive tests only out of several hundred. So that is very reassuring, and we are working with those individuals, obviously.
Thank you, Laura. Do you have any
Okay,
other questions?
so- Yes, I was going to ask just a follow-up. So with the glitches, that was more on the end of Quest processing the test results. Is that what you're saying?
I'm not exactly sure whether they're, because they just started with their first site on Wednesday, followed up with the second site on Thursday, and then the third site on Friday. So as you know, in the beginning, sometimes things have to be smoothened out between the people collecting the samples, processing them, labeling them correctly, and then getting them to the lab, and then Quest receiving this bunch and getting the results back to us. Sometimes it can be as much or as little as an IT problem with the computer software that can do the problem initially. But they're working on it, they're aware of it, and I'm quite confident that this will be sorted out within this week.
Okay, thank you for going overtime to answer all these questions. I appreciate it.
Thank you, Laura. That is all the questions we have.
Well, thank you very much, everyone, for being here. As each of us begins to move around the community a little bit more to integrate new shopping opportunities into our daily lives, we have to please remember to maintain the simple things that have worked to reduce the spread of the virus. It's important to maintain our vigilance about the simple things like staying home as much as possible when you're not out shopping at local businesses. Remember to wear a face covering and stay at least 6 feet away from other people. Wash your hands often, stay at least for at least 20 seconds, and also don't touch your face, and disinfect surfaces regularly. And if you feel sick, isolate yourself at home. If your symptoms worsen, call your doctor or medical clinic and follow their advice. Our next press conference is Wednesday at 4:30 p.m. The Board of Supervisors meeting begins tomorrow at 9 a.m. and we'll also have an update from the Public Health Department. If you have any additional questions, please call the county's call center line at 833-688-5551. Thank you for joining us today.